So for more perspective on these protests now, I want to bring in Dr. Shajan Ahmed. He's an ER physician who works at one of the hospitals targeted by the protesters, and he's joining us now from Toronto. Dr. Ahmed, thank you for joining us.
Thank you for having me.
What is your reaction to this? When you see protesters like this, when you see these people outside of, the hospital that you work at, what do you make of this?
It's infuriating, and it's completely reprehensible, it's cowardly, and it's extremely frustrating after everything we've been through as frontline workers. This is just another added blow to a difficult situation. So it's very frustrating. I'm at a bit of a loss for words.
And you think back to what we saw in March or April of 2020, for example, when this first started in Canada, and people were going outside in the evenings, were banging pots and pans from their balconies, that sort of thing. So are you surprised by sort of this turn that we've seen over the past couple of months and since the pandemic started?
It's very bizarre. A year ago, I could walk proudly in my hospital scrubs, and now I'm actually fearful to walk in certain areas after a shift in my hospital scrubs. And so that is a very bizarre shift to go from being frontline heroes to public enemy number one in some cases with some of these groups of people who have targeted us. It's frustrating, it's completely demoralizing, and it hasn't helped our work situation, our already difficult work situation. And so it's beyond words, it's beyond comprehension that we've come to this, and I'm not sure what to make of it.
And talk to us a little bit about some of these security concerns, especially for some of your colleagues who are going to work today. Are you concerned about their safety?
I am concerned about their safety. I do have a lot of colleagues who are going into work today who are in their hospital attire, and they're doing their best to look after patients, and they're having to potentially traverse these mobs of people who are obstructing. And, although they've pegged these protests to be silent, who knows if they actually will be silent. And it being silent or not, it still poses a threat not only to patients, but to the workers who need to get to work and look after these vulnerable patients. And ironically, we are going to work to look after the very protesters who sometimes need to come in with medical emergencies. So yes, I do know colleagues who are going in. I am proud to say that they're going into work regardless. They're going to go in and they'll walk across the fire if they need to do the job that they need to do because they are professionals.
And are you and your colleagues, are you doing anything differently now when you're going into work? Or, I don't know, are you taking a different route? Or are you trying to make sure that you're not in your scrubs on the way in? Is there anything that you've actually had to sort of change about your work routine because of what we've been seeing?
I definitely do not walk around hospital grounds or the downtown core in my scrubs as I would have done in the past. Even to step out to get a coffee, I probably would be hesitant to do that at this point. I'm very reticent to even talk about what I do, to be honest with you. So yes, behaviors have changed. And that's really unfortunate because we do what we do with great pride, and no one should feel fear, especially in their own hometown and the area that they work in, for the work that they do.
And I want to talk a little bit about the response that we've heard from some politicians, including, Ontario Premier Doug Ford. He has condemned these protests. And then when we just played that clip from people like Jagmeet Singh, who say that there should be sanctions against these demonstrators. So do you think that the governments, do they need to be doing more to stop these protests?
Absolutely. The power is in their hands. Condemnation and strong words, absolutely, we feel the solidarity, and we can all agree that these are completely immoral acts to have these protests on hospital grounds. But we need to do more. We need to actually fast forward to mandating legislation to ensure that we do treat the hospital area as sacred ground. As my colleague, Dr. Venugopal, has mentioned, this needs to be sacred ground, and we need to treat it as such. We know that if you assault a police officer, that is a criminal act. We need to treat this the same way. We need to treat any assault, be it verbal or physical, to an essential frontline worker needs to be treated as a criminal act. And there needs to be, beyond sanctions, there needs to be strict legislation to ensure that we protect essential frontline workers and that we protect the grounds of healthcare facilities where we have vulnerable patients and healthcare workers having to get to the facility in a safe manner.
And Dr. Ahmed, we've been in this pandemic now for so long. Do you think that there's a chance that these people who take part in these protests, that they might change their mind? Or do you think that there'll always be a certain percentage of the population that simply can't be reached?
That's an interesting question. I spent a lot of my time over the past few months trying to reach out to these anti-vaxxers as much as I could. And I realized that they fall into different camps. There are those who are hesitant, and there are those who absolutely do not wish to accept any form of science, and the truth is only their personal truth. And I call that subset. In the hospital, we have something known as DNR, do not resuscitate. Well, I call this subset do not rationalize. They are DNR, and I don't think that this is a group that we can effectively change. And so we have to navigate around that. I do think, however, there's a subset of people who are hesitant and who are victims of misinformation. And I think it's our duty as healthcare professionals and lawmakers to reach out to these particular individuals with the correct information, with campaigns, and with incentives if need be. We see some jurisdictions that are providing financial incentives, if it means vaccine passports, if it means you want to go to a Jays game, well, you need to get vaccinated. We actually see those things working. As soon as passports were announced, we actually saw a huge uptake in people trying to get vaccinated. Listen, it's a privilege to drive, and I need a license to drive, and that's important that I'm a safe driver to protect the public. Well, we need to treat this the same way. If you want to be out in public, if you want to be at the bars and the restaurants and the sporting events, well, this is what you need to do. We're not in no way saying that you should be denied your basic rights, but we need to provide as many incentives in addition to informative campaigns, along with compassion and understanding for those who are in the middle ground, who are victims of misinformation. But there is a subset of people that we're just never going to change. And we've seen that with every vaccine campaign throughout history. There's just people who are going to be resistant. So I think it's wasting time and energy on those particular individuals. I think we need to protect the rest of society from those individuals.
And of course, all of this is happening during a fourth wave of the pandemic. You work in an emergency room. You've worked in COVID vaccine clinics. Give us a sense of what you're seeing right now on the ground in terms of where COVID is at, where you work.
Well, I must say we don't see as much COVID as we did during previous waves, because we do have a significant number of population who have been vaccinated, but we still see COVID positive patients trickling in. As an example, just the other day on one of my shifts, I had 5 COVID patients who are all otherwise young and healthy who would come in pretty sick, all of which were unvaccinated. And so the thing that's changed is the compassion fatigue is starting to kick in. And we try our best to be compassionate providers, but it's very difficult to manage someone who's willfully chosen this route and has put others at risk, including myself. I have a family to go home to as well. And so it's frustrating. The other thing that we're also seeing is the backlog of patients who did not get adequate care during previous lockdowns. There's backlogs in surgeries. There's people who are coming in with chronic conditions who are unable to still see their family physicians because of the restrictions and the lockdown. So, we took a difficult situation pre-COVID, and we just made it that much more difficult. And now when we had a chance to get things under control, we have this fourth wave that's primarily dominated by the unvaccinated folks, and that's really having an effect on our healthcare system.
Dr. Shajan Ahmed, thank you so much for coming on today and for sharing your perspective, what you're seeing, what your colleagues are dealing with. We really appreciate it.
Thanks for your time.
That was Dr. Shajan Ahmed, an ER physician, joining us from Toronto.